What is a brow lift? A brow lift has to do with your eyebrow. And so when we are doing a brow lift, we're taking a patient whose eyebrow has drooped down and it creates an appearance of looking kind of tired or maybe even a little bit angry or grumpy. And so what we do is try to lift the brow back up to a more natural position, which is right around the level of this bony prominence above our eye. So how do we do a brow lift? Well, there's a couple different approaches we have. One approach is called an endoscopic brow lift, which is when we make some small cuts in the hairline up in the scalp. And then we use a camera to perform a careful dissection, making sure that we identify any of the important nerves in the area. And then we're able to pull the tissue back and then anchor it to the skull bone itself with some screws and some sutures. Another approach we have is called the direct excision brow lift, where we actually make a cut right at the upper border of the brow with some extra skin on top of it, and that allows us to pull it back up and keep the scar relatively well concealed. Another approach that I actually really like to use, and I use most commonly, is something called a temporal brow lift. And in this temporal brow lift, what we do is we make a cut in the hairline on the side of the forehead, and we are able to get down to this part of the brow and pull it back and remove some excess skin and tighten up the area through a scar that is then well concealed in the hairline. If you like content like this, feel free to leave us a comment or like us, and always feel free to visit us at cpsdocs.com.